Hello, my name is Dr. Libia Scheller, and I'm the medical director with the Institute of Medical Education and Research. And we are reporting here live from the 2010 American Society of Clinical Oncology annual meeting here in Chicago. And we're so excited that we actually have Dr. Tim Turnham from the Melanoma Research Foundation. Thank you so much for joining us today.
Thank you for having me.
And one of the exciting things that we have here is there was a phase 3 trial reported here at this year's ASCO for the treatment of patients with melanoma. And we'd like for all of you to have a perspective as to, from a patient advocate, because Tim is a patient advocate, as to how this impacts not only patient advocates, but how it affects patients. So Tim, can you tell us a little bit about yourself and your foundation first before we get into the impact that it has had here at ASCO?
Sure. The Melanoma Research Foundation is the largest and oldest national nonprofit working specifically in melanoma. Mm-hmm. We fund medical research for new treatments and cures, and we also provide patient and support and advocacy. We have the largest patient footprint in the melanoma space of anybody in the world. And we're committed to making a difference in this disease and turning it into a chronic or manageable disease.
As you know, we have a new immunomodulatory agent called ipilimumab that has been reported here at this year's ASCO. Can you tell us a little bit of how you feel yourself this is going to impact advocates when it comes to education and also patients and the level of education that they're going to need to understand how this agent can impact them in their treatment?
Sure. Well, this is huge news for melanoma. I was in our chat room with a patient a week ago, and she said, every time ASCO is coming up, my stomach gets tied up in knots because there's more bad news for melanoma. I told her, stay tuned for this ASCO because it's a different story. For the first time ever, we've had a randomized phase 3 trial that has shown overall survival benefit in melanoma for the first time ever. This is a game changer. It's a first-in-class drug, makes a huge difference. Having said that, it's a good solid base hit. It's not a home run. It's not the answer, but it lets us know that we are on the right path to an answer. With a lot of things like this, it creates opportunities and challenges. And so framing the message so that patients know that they can't go out and get this and be cured automatically. How to manage side effects, how to deal with this with other drugs. These are some of the challenges we now face in educating patients about this.
What do you currently have as a patient advocate? How do you yourself keep yourself educated when it comes to the field of melanoma and what the new agents are that are coming? Because, you know, it's rapidly increasing.
Right.
You know, with ipilimumab, that was not the only data that was presented here at ASCO. There's, you know, many phase 1, phase 2s, and other molecules coming along. And so there's a lot of information. How do you yourself stay educated and up to date on all these new agents coming out?
We're fortunate to have a very strong and long-standing relationship with the research scientists who are developing these drugs. Some of them we've funded in the past. We certainly have funded their fellows or their postdocs who are working in their lab. We have an ongoing conversation about what they're working on. So when I'm approached by a company, for example, who has a drug in development, early stage development, they want to talk to me about that drug. There are a handful of people I can speak with on the phone and say, what does this look like? What are you thinking about this drug? Is there promise here? What questions should we be asking? So having that relationship with the research community makes a huge difference.